I'll be talking to you about emergency contraception, and the outline of my presentation would basically be talking about objectives, trying to define what is emergency contraception, introduction of emergency contraception, when to prescribe emergency contraception, some side effects of this emergency contraception, as well as their management. How effective are these emergency contraceptions to prevent pregnancy? What are some choices for future contraception options, as well as take you through the summary of my presentation. So the objectives are basically define what are emergency contraceptives, list the types of emergency contraceptives, who are some candidates for emergency contraceptives, discuss the mechanism of action of this emergency contraception, as well as explain some common side effects from this emergency contraception. So basically, emergency contraception is the use of drugs or medication or a device as an emergency measure to prevent pregnancy. These emergency contraception pills are usually called Plan B, morning after pill, or post-coital contraceptive pills. So we either have pills or devices for this emergency contraception, whereby we have special emergency contraceptive pills, which usually have progestin-based products like levonorgestrel, as well as combined products where we have estrogen and levonorgestrel, as well as also progestin-only pills like levonorgestrel or norgestrel. So we have the option of having combined as well as progestin-only based pills. We also have the option of using an intrauterine contraceptive device to try and prevent pregnancy. So basically, when are we supposed to use emergency contraception? This is they are usually taken as soon as possible after unprotected sex, and any time up to 5 days after unprotected sex. So this is usually the time window for use of emergency contraceptives. So who is a candidate for emergency contraception? Basically, all women who can use emergency contraception safely and effectively. These are usually people who have had unprotected sex, or are misfortunate enough when there is a condom rupture or slippage. They can use this as emergency contraception. Also, for people who are usually taking oral contraceptive pills, which can either be combined or progestin-only contraception pills. So if they have missed their pills for 1 up to 3 days for combined oral contraceptive pills, they can use this emergency contraception as a measure to try and prevent pregnancy. For progestin-only oral contraceptive pills, if he has missed one dose, maybe within a time frame of 12 hours, he is usually a candidate to take emergency contraception pills. Also, for cases of sexual assault or rape, they want to prevent pregnancy, they can use the emergency contraceptive pills. Some of the doses for the emergency contraceptive pills that we have on the market: we have a progestin-only pill, which is the post pill or mini pill, where we have a single dose for levonorgestrel of 1.5 milligram, which can be taken as a single dose. Or we have the option where we have half of that dose, 0.75 milligram of levonorgestrel. So if it is 2 tablets, they usually take them 12 hours apart, and this is the most common and recommended emergency contraceptive pills that we have on the market. For estrogen and progestin-only products, where we have a combined estrogen and progesterone-based pill, we have different products and trade names on the market, which some are containing 0.1 milligram of ethinyl estradiol combined with 0.5 milligram of levonorgestrel. These are usually taken 12 hours apart, because usually they come in 2 pills as compared to 1 pill which is available. For progestin only pills, we have the option of having levonorgestrel or norgestrel. For levonorgestrel pills, we have 1.5 milligram tablets which are taken as a single dose, as well as for norgestrel pills which are 3 milligrams taken as a single dose. For combined oral contraceptive pills, the options are we have 0.1 milligram of ethinyl estradiol, which is not changing, which is combined with 0.5 milligram of levonorgestrel, which is usually these are 2 tablets and they are usually taken every 12 hours apart, as well as having a 0.1 milligram of ethinyl estradiol, which is combined with double the dose of levonorgestrel. We have 1 milligram of norgestrel. These are also 2 pills which are taken every 12 hours apart. We also have another option of 0.1 milligram of ethinyl estradiol, which is mixed with 2 milligram of norethindrone, which is also 2 parts of a pill where we take them every 12 hours apart. So how effective are some of these emergency contraceptive pills which are on the market? If you had 100 women, each had unprotected sex during the 2nd or 3rd week of a menstrual cycle, for someone who is not taking any form of emergency contraception, out of every 100 women, 8 would become pregnant. As compared to progestin only emergency contraception, of the 100 women, you'd only have 1 of them getting pregnant from use of progestin only emergency contraception, as compared with the ones who are using combined estrogen and progestin based pills. Of 100 women, only 2 would get pregnant. So for the most effective is progestin only contraceptive pills. Also, we'll talk about the mechanism of action of these emergency contraceptive pills, whereby they act at about 4 levels. At the first level, where we have inhibition of ovulation by causing a regression of the corpus luteum cyst, and it usually inhibits ovulation and prevents pregnancy. Also, we have the second mechanism of action, which is basically thickening of the cervical mucus. This thickening action makes the cervical mucus to be thick and sticky and prevents the upward migration of the spermatozoa or sperms towards the egg. So it prevents this by making it sticky and prevents the upward migration of the sperm. Also, the third mechanism of action, it delays ovum and sperm transport, and this delay can cause the woman and prevent pregnancy. In the eventuality where a woman gets pregnant, it can also work at the level of the endometrium by inhibiting implantation. So some common side effects from emergency contraceptive pills. Some women will report a change in their bleeding pattern. If they are expecting some menses, they can sometimes come earlier, a little earlier or later than the expected time. So this is one of the common side effects from using emergency contraception. Also, we have some side effects usually from combined oral contraceptive pills which have an estrogen component. They tend to have some GI side effects, some gastrointestinal side effects like nausea and vomiting. In the case where you have the combined pill which has 2 doses, they can cause nausea and vomiting. In the case where you have these common side effects like nausea and vomiting, you can usually associate to try and relieve these side effects by giving some anti-emetic medication like metoclopramide or ondansetron to try and prevent these side effects from worsening. But usually for all combined pills, for women who have these common side effects, usually, as you know, they will be excreted, and after a few days the woman will return back to her normal state. So there are some common misconceptions about emergency contraceptive pills, whereby women talk about the emergency contraceptive pills causing abortion, birth defects. Sometimes they will talk about they are being dangerous to a woman's health, as well as promoting risky sexual behavior or making women infertile. So the role of emergency contraceptive pills usually is to prevent pregnancy. It is usually to prevent the sperm from meeting with the ovum and fertilization from happening. It has no, it does not cause abortion, it doesn't cause any birth defects, or it doesn't make the women infertile. Basically, after it is excreted, its mechanism of action is prevented. So for follow-up, if there is usually no routine return visit is required. If she doesn't have any side effects, she should only seek follow-up or care after she has missed her next menses by more than 1 week, or if she presents with some signs and symptoms of pregnancy like nausea, vomiting, or breast tenderness. If she presents with some symptoms, she should seek for care and also to do a pregnancy test. So for planning for future contraception, emergency contraceptive pills do not protect from future pregnancy. The woman should be given the option to choose for other types of contraception which are more effective, and you should also invite her to come back anytime in the case of any side effect, and also give her the option of more emergency contraceptive pills for future use if she doesn't desire pregnancy. So the woman should be explained to that emergency contraception is not a regular method. It should only be given as an option in the case of unprotected sex, and within that time frame of 5 days. So other contraceptive methods are more effective in preventing pregnancy, like oral contraceptive pills, which are taken on a daily basis, implants, use of intrauterine contraceptive devices, or injectables. They are better at preventing pregnancy because they are more effective. So they should be explained to that emergency contraceptions are not for regular use. They should only be used in the case of emergency. So we have also the option of using devices like intrauterine contraceptive devices, like we have two types, where we have a copper-based intrauterine contraceptive device, which is the most common, and we also have the option of having progestin-based intrauterine contraceptive device, which is called Mirena. So for the copper-based IUCD, it's usually used for up to 10 years. And for the progestin-based IUCD, it's usually used for 5 years. They should also be inserted within the 5-day window, and they are very highly effective for preventing pregnancy. So it can remain in place for the 5 to 10 years, and it's really a good option for long-term contraception if the woman does not desire pregnancy. Some common contraindications for use of intrauterine copper-based contraceptive devices is they are usually contraindicated for in the setting of uterine anomalies, like biconjugate uterus or fibroids, whereby if there is distortion of the uterine cavity, upon insertion of these intrauterine copper-based or progestin-based contraceptive devices, they are usually likely to be expulsed if they are not put in a proper place. So also in the setting of acute pelvic inflammatory disease, which is present or has been in the past 3 months, this is also a contraindication for use of intrauterine copper device. This usually is because in that setting it can lead to more ascending infection, and they can proliferate up to the level of the abdomen and cause even serious disease. In the case where you have pelvic malignancy with abnormal uterine bleeding in the setting of either cervical or endometrial cancer, it's not recommended to use these IUCDs. Also for undiagnosed abnormal vaginal bleeding in the context of either a structural cause or non-structural causes for vaginal bleeding, it's not recommended to use intrauterine copper-based IUCD. Also for copper-based IUCD, people who are allergic to copper, it's also a contraindication for use of IUCD. We also have other 2 methods of emergency contraception which are not very common. We have a new method using ulipristal acetate. It's usually highly effective and well tolerated and can be taken up to 5 days after unprotected sex. It's in most studies it is shown to be more effective than progestin-based emergency contraceptive pills. And we also have the 4th option of mifepristone, which is highly effective and has fewer side effects. So in summary, emergency contraceptive pills or a device use of intrauterine copper contraceptive device, it can prevent pregnancy when taken or used within as soon as possible after unprotected sex up to 5 days after unprotected sex. Levonorgestrel based emergency contraceptions are the most commonly used. They come either in single dose or double dose, which is taken after every 12 hours. So emergency contraceptions do not disrupt an existing pregnancy. They are usually safe for all women, and they are not recommended to be used as regular contraception. They are only used in quotes as emergency. Emergency contraceptive pills do not protect against sexually transmitted infections, including HIV. If there is a risk of sexually transmitted infection or HIV, it's usually better to use barrier methods which are recommended to prevent pregnancy. Thank you.